Hi, I'm Dylan Birdsell. So what we're going to do is we're going to talk about what core training is and try to kind of differentiate the differences of core training needs when it comes to general population, to clinical patients, to athletes, kind of everything in between. So we'll try to do this as concisely as possible. Now, there's a lot of information, so we'll try our best. So basically, a definition of what the core is I like to think of like where the axial skeleton sits and where the organs sit. So if we look over here to the skeleton to the right, you'll see just like the spinal column, the rib cage. That's a pretty general area, and it's not the perfect definition. We'll get to that here in a couple of seconds, but just for simplicity, that's what I like to say is that whole middle portion of the body is the core when it comes to training it. So think of movements, okay? So you look over here, they say 6 functions of the spine or 6 degrees of freedom. We have flexion, extension, rotation, and then I call it lateral flexion to either side, or you can call it a tilt, side bend. There's a lot of terminology that gets thrown out there. But the really cool thing is the core, it moves in all 3 different ranges of motion just because of how many different connection points it has. You know, the core is connected to the pelvis, connected to the shoulder, you know, your scapula, rotator cuff. We have 3 different sections of the spine, you know, that go through rotation. We have our C-spine, our T-spine, our L-spine. So there's a lot of moving parts here. It's really important just to kind of train this properly. So we get right here, and then let's see if this video will play. Yeah. So found this in I can't remember what paper exactly, but they reference Akutada. Her paper and her definition is the core refers to the muscular box. Let's see if we'll play this again. The muscular box consisting of the abdominals in the front, the paraspinals, the gluteals in the back, diaphragm as the roof, and the pelvic floor and hip girdle muscles at the bottom. Functionally, these muscles are centrally located in almost all the kinetic chains, important for stabilizing the spine, the pelvis, providing proximal stability and distal mobility of the function of the limbs during everyday and sport activities. That's a mouthful. Basically, we go back to the spine right here. Well, not let me go back slides. Okay. Oops. So you think about is if you have your skeleton, you look at the bottom of the pelvis, the hips, you think about your glutes, where they said the gluteal wall, and you can go back up to the diaphragm. That's the technical definition of the core. Me personally, I still like to go even higher than the diaphragm just because our spine kind of travels all the way up there to, the spine travels all the way up to the top of the skull, but still there's other upper mobility things that can affect the core in its training. We'll get to a little bit later, but that's kind of a very simplistic way of grouping everything together. So what do we train when it comes to the core? I kind of break it down to 4 different characteristics, in my opinion. You can train aesthetically, which is the majority of core training, what most people do. Now, we'll think, is it the best thing to do? We'll get into that more, but we think about mobility, so how we actually are able to get through all these motions, and this is something that's really important when you start to get into performance and the clinical side as far as helping patients. A lot of PTs really get into building strength and building mobility into their core of different patients of back issues or other things. Quality of movement. This is in everyday life and in sports. And then functional strength, just the strength to actually just sit in a chair, to get in and out, how to bend over, a lot of different things like that. So we think about aesthetics. So everyone wants beach bod, everyone wants a 6-pack, all these different things. And that's originally what people go for when they think of training the core, and you have these legendary, let me see if I can move my face. I might not be able to. Okay. But right here, you already see like legendary abs of steel type of exercises. And to me, really, though, what are they exactly? It's just, for the most part, it's a lot of challenging up the rectus abdominis and your obliques, really just trying to kind of hold an isometric or even go through just a concentric motion of shortening. So you think of like a crunch, think of like a sit-up, a V-up. There's about a billion different ways, and you're just literally only challenging your rectus abdominis to sit there and go through the shortening phase. And then you'll get into some other things where people are trying to get a little bit more fancy, trying to challenge the obliques. You'll see Russian twists, bicycles. You'll even see a lot of people get a kettlebell. It's one of my favorites to see people in the gym get a kettlebell and they'll hold the kettlebell to their side. Let me see if I can show you. Like they'll get a kettlebell and they'll hold it to their side and they'll do this whole number right here where they're just dipping and it's like, yeah, I'm challenging my oblique on the opposite side. It's like, I wouldn't say that just because of the center of gravity, how it's pulling, and just how our obliques being challenged, but that's for another day. So what's the purpose of aesthetically training these? Really just to, I use fancy words here, but overall hypertrophy of the muscles and muscle fiber visual distinction. Everyone just wants to see their abs. That's the reason why they do this, and to let people feel good about themselves. So I think that's the purpose of it. And what can we use it for an athlete? Honestly, it's kind of the same thing. It's like, okay, maybe I make you do sit-ups. Sure, we might get a little bit of strength in the flexion motion of the trunk, but we'll talk about it a little bit later. We really don't need a lot of flexion of the trunk to do a lot of things. That, if anything, we're actually trying to fight flexion to get quality of movement in our different things. But either way, you get athletes, yeah, go do 100 sit-ups, crunches. Maybe they see their abs a little bit better. Maybe they just feel better. And ultimately, the psychology of feeling better, playing better, it does match up. So mobility and stability. So yeah, we think about understanding your population. Do I have an athlete in front of me whose purpose is to play a sport, or do I have a client that's coming in, they're overweight, they have low back issues, and their core strength is abysmal? Or do I have just your regular gym goer that's just trying to get shredded for the beach this summer? All those different things. Stuart McGill actually writes in a paper right here. I'll read it, but he's like, some people need more stability while others need more mobility. Some exercises may exacerbate, oh, I said that really bad, exacerbate the back troubles of some people and may help others, because each individual has different needs. Various assessment approaches should be utilized to aid in subsequent decisions for exercise design. So yeah, there's a lot of different things, you know. We'll talk about the plank here in a second, but the plank's really controversial of, does it actually help low back pain? Does it gain or does it prevent it? There's all kinds of things. I really like to think this is with all joints in general, but limited strength at end ranges of joints can lead to pain. Just in general, the less strength we have, it changes different receptors, so pain receptors versus mobility receptors in the body. So by increasing your mobility, you should be able to increase your strength if your mobility is not there, and it can be vice versa as well. So let's talk about that controversy. So right here on the left is from a paper that quote from Stuart McGill had, but he says right here, it's a little small on my screen, but for the main purpose, not low back exercises performed for maintenance. So we think about our population that is struggling with low back pain and things like that. More repetitions demanding exercises will assist the enhancement of endurance and strength, which I really agree. He's a really big proponent on what's called bracing of our spine. So he loves planks, and he actually doesn't think we need to do planks more than 10 seconds to actually get the adaptation from it, because over the longer period of time, we're just going to stop with the bracing motion, which I agree with as well. So if we actually, instead of doing 2 minutes of planks, just holding position, just fighting everything, we actually wind up changing our position of our shoulders, maybe our hips, other things like that. We aren't actually getting the proper tilt of the pelvis during this exercise, what it's designed for, then we actually don't get anything out of the exercise. So he's a proponent, is like, we only need to do planks for like 10 to 15 seconds. You know, as long as you're squeezing everything as tight as you possibly can, we will be getting adaptation out of it. And the last thing right here at the bottom, he says, there's no such thing as an ideal set of exercises for all individuals. Individuals' training objectives must be identified B, they rehabilitation, specifically reduce the risk of injury, optimize general health and fitness, or maximize athletic performance. So it just kind of goes back to what I wrote on the last slide is know your population. Who are you working with and why and how should you be training your core differently? Not every single person needs to get in there and do 150 sit-ups. Not every single person needs to get in there and do 2-minute planks, just because it works for one population does not mean it works for another population. So the other half of this picture right here is Jeff Cavalier. Jeff Cavalier is pretty well known in the fitness industry on YouTube and things like that. And he's actually not a proponent of planks in general, just because he thinks that there's a lot of stuff that doesn't come from it. He talks about promotes bad posture right here in this. He says you get zero glute activation just because the gravity's pulling you down. Your glutes actually pull you up, squeezing of the glutes. Doesn't cause you to get into this proper hip position. Actually, what it does, he's saying that we're more into hip flexion instead of hip extension right here. But I would argue just because by squeezing the glutes, squeezing the quads, what we're doing is we're actually changing the pelvis. Actually, see right here, we're changing the pelvis right here on the right side. This is what we want. We want a stacked position compared to right here in front where we go into a little bit of a anterior pelvic tilt right there, where you'll see a lot of people, they dip their lower back into it. So by squeezing our by squeezing our glutes, by squeezing our quads, what we actually do is we wind up getting that rotation back and we get more of a stacked position. So yeah, technically we're not actually giving the glute hypertrophy work or any like strength working right there, but what we are doing is we are getting the neuromuscular connection right there to contract and to teach our body the position of what with a proper pelvic tilt to get the stacked spinal cord to go during a plank while gravity is pulling us down. So there is benefits to this right here. So to me, that's kind of a whole thing right here when it comes to core training is how can we get back to a neutral spine? Because that's where a lot of problems is if we can't get your pelvis to actually get to the proper positions in sports specifically, we can't get to our proper sprint mechanics. We can't get to our proper jump mechanics. And the same thing, we get up to the rotator cuff and we get into our pressing. If we can't actually hold this neutral spine and we get into our anterior pelvic tilt or we get into a posterior pelvic tilt, maybe we become a little bit kyphotic. There's a lot of different things that come up right here that will limit our performance. So we think right here of quality of movement. So I just want to show a little bit of real life experience right here is you see me right here on the left, top left. This was when I first started training, just sprint training in general. And during this time when I was doing weightlifting, I never did a single crunch. I never did a single sit-up, a V-up, whatever, bicycle, Russian twist, whatever you want to call. I trained my core to be able to fight that flexion because as we see right here, I go straight into flexion right away. I don't know how to have this proper pelvic tilt to get that full extension of the hips. You see right here, boom, and that's where a lot of problems with a lot of people with lower core strength will have. One of them right here, top right, is one of my clients. Same thing, not the most relative strength of the core, so he's not able to get that extension, changes his movement mechanics so he doesn't sprint as fast. And down here at the bottom, you see relatively, this was about 2 months difference for me. This is about a month different for him. And right away, just by strengthening our core and trying to teach that pelvic tilt, trying to teach that strength to hold position and movements, that is where we get actual changes in sport, not because we can do 150 more sit-ups and crunches a day for core strength. No, core strength is actually the ability to fight like extrinsic outer movements that want to pull us away from our proper positions where so we think of like anti-rotation, we think of holding extension of the spine a whole lot. That way we can, like I said, get our pelvis, get our shoulders, get everything in proper alignment so we can move better. So what I want to talk about right here is disassociation of the hips. So like movement, this is where we start to get into quality of movement. And this ties in a little bit of the mobility side right here. So this is another client that I had. And right there you see the very beginning. Let's play it again. Watch his hips open up. Hips will open up, just showing a little bit of lack of what I call disassociation of his pelvis, and his trunk. This is where the rotation comes in. So when we're going to linear sprinting, we want everything to be in a proper line. But when we actually go into our movement in a frontal plane, we want to be able to keep that disassociation. I want to be able to keep my shoulders nice and open and be able to move laterally without having to open up the hips and try to turn it into a linear motion. So for younger athletes, this is something that's great and fantastic is maybe we don't need, when we go into core strength, we don't need to go back to the crunches, back to the sit-ups, but instead what we need to do is we need to expand his ranges of motion, kind of like what McGill said in the beginning is, do they need stability? Do they need mobility? Right here, I would argue probably a little bit of both, but more on the mobility side, just so that he can actually learn how to go into abduction of the hips using his glutes. Well, his glutes are connected to the pelvis, so all that goes back to now have that disassociation and that strength right there. I'll show you one more time. Opens those hips right there just for a lateral movement, and a lot of kids do this. Or just younger athletes in general. So we think about programming, like I said, I wouldn't do many V-ups or anything like that, but here's a video of me. Let's see if I can get to the spot I want it to. Yeah, sorry about that. But basically, that video was supposed to show me going through a rotational T, so working on a little bit of T-spine trunk mobility, the ability to keep my hips facing one way while opening up the rest of my spinal column into rotation in a safe manner right there. As we talked about in sports, you got to be able to have that ability to disassociate when it's needed, but also when to be nice, locked on, and strong when we call the bracing area. So we think about right here, get into, like I said, the top portion of the core and its relationship with things like our rotator cuff and overall just upper extremity strengthening. So right here, it's kind of ironic. This guy's post was how to do proper overhead press. I would actually kind of disagree with his press. As you see right here, we follow what the spine does, and we see a little bit, not a little bit, actually quite a bit of an anterior pelvic tilt right there. And to me, this shows right away, this guy's he's got pretty big size to him, but maybe because of that size and he's always worrying about, maybe he's just an Olympic lifter. It's hard to make a lot of different assumptions, but just for his only goal is to get that bar up. He doesn't really matter a whole lot. But when we think about sports, is we want to be able to keep that stacked spine to make sure that we're not disassociating anything. The thing that scares me too is if you put weight on here and you think about right here at this end position right here, think about that spine and you think of the line of gravity that's not going to go down. That puts a lot of pressure right here on that lower back. So something I would like to do is if I was working with an athlete that had this same type of motion, is I would encourage them to keep their rib cage in. And while they go through the pressing motion, that way we see more of a neutral spine, see them try to challenge our overhead extension. And this is something that you see a lot of overhead athletes that have great mobility that they can do. You think of like swimmers, throwers, anything like that, is they're able to get to this motion without having to sacrifice everything in the middle portion of their body just to get there. So I'm going to end it off real quick just by touching on proprioception. This is a hot debate just in the world of fitness and what we need when it comes to athletes, training them. Do we need instability training? Do we need stability training? What actually gets the core more? I just wanted to leave a little bit of information right here as we do have 5 different types of proprioceptors, and these are really important because these go into all different types of training, not just core training. But we think of our Golgi tendon organs, the relaxor muscles. These are a little bit of protective mechanism. These are protective mechanism when it goes along with our free nerve endings as well. Our muscle spindle, these are the things that help with amortization. So that quick twitch that everyone's looking for, if you see. So muscle spindles are the reaction basically to try to keep elastic energy stored in things. So this is something that's, I think this is like the main proportion of what a lot of people do when they try to do proprioception training, is they're trying to activate their muscle spindles as quickly and as effectively as possible. There's some truth to that, some not truth to that. Always like to think of like risk reward. These other two, just little minor things that also will help and assist. But I'll play right here, risk reward. This is a video of Alvin Kamara. He's been him and his trainer is a physical therapist out somewhere in Florida. Highly debated stuff of what these guys do, but you see right here the whole purpose of this is quote unquote proprioception training. Play it again. You see right here it's about creating a stable or unstable surface using the kettlebells right there, and it's just risk reward. How much is he actually getting out of this? Versus what are the possibilities of getting hurt? What are the possibilities of maybe doing an overuse injury or anything like that? Now we obviously need to be able to control our body in uncontrolled environments when it comes to sports, but sometimes we don't need to replicate everything, because does this actually prove, or does that bring benefits to the field? I mean, I would probably argue not, but I mean, that's what everyone else is up to debate. You're more than welcome to do it. There's a whole, different type of argument we can do for that, but I'll leave it at that for today. So yeah, questions. How would you change how you train the core of an average gym goer compared to an athlete? What are different exercises you would use? What are different ranges you would use? What is your purpose for each one? What type of core exercises would you try to avoid with someone that has lower back pain? And what do you think of proprioception training or instability training in general? Have you ever done it? Do you like it? Do you think it's mandatory, or essential? And what is its relationship with core training? Do you think that it does have a relationship with core training? And like I said, it's a hot button to debate. So and then we have a few of my references that from the papers I read, just kind of help refresh my information on this. And that's really all I have for today. Thank you.